Three of the people who play a central role in their own way, big, small, who play a role in upholding that social contract that we in healthcare have with our communities are our speakers at our lunch program here. Dr. Gary Kaplan, the chairman and CEO of Virginia Mason, Dr. Sally Watkins, the executive director of the Washington State Nurses Association, and Leanne Berge, the CEO of Community Health Plan of Washington. Let's invite them up to the stage with a round of applause. I hadn't had a chance to say hello to you yet, Leanne. I thought, oh my gosh, maybe I need to invite Representative Schmick up to the stage to fill in for somebody. Why don't you grab a seat there? Thank you all for joining us, for participating in this conversation, for supporting state reform. I really do appreciate it. Sally, let me start with you. You, at the head of the Nurses Association, you lead an important group of providers that are increasingly even more important as we move into this sort of care coordination, case management model. But workforce continues to be this thing that we all talk about, and there's a lot of work getting done on it, but a real solution on workforce is a long ways away. What are the kinds of things that you spend your mental energy on at the Nurses Association, related to workforce in particular, but related to this broader health reform conversation in general?
Well, I think one component of this is part of the quadruple aim, really, looking at the provider experience, and the nurses are providers, just as are physicians, nurse practitioners, PAs, et cetera, and making sure that they have the right work environments that they can practice in, and that we avoid issues of fatigue and burnout and violence in the workplace, that sort of thing, so that we can hang on to the workforce that we have, and also make sure we have the environment that creates a workforce where new nurses will want to come and work and stay involved and stay engaged and want to continue to hold on to that profession for their entire career, and not be something that they feel that they just can't manage the stress, that they can't manage the requirements or demands that are being placed on them. So I think that's a big part of the workforce issue, is the work environment. This
burnout issue of providers, right, which is not just nurses, of course, a lot of folks. Gary, how about you? Same type of question, leading a health system. What are the things that you have really central on your radar screen, the things that you are thinking about as a physician leader and administrative leader in terms of the external community, but maybe also internal?
Yeah, it really does fall into two buckets. You know, my day job as a leader and leading a fabulous team of people at Virginia Mason, and attending to our organizational psyche, ensuring that our team member experience is where it needs to be. As Sally has said, how important that is to then ensuring the quality of what we're able to deliver in the patient experience is what it needs to be, and that we are also wise stewards of our precious community resources. So I think a lot about that and how to stay true to our vision and mission. And then I think about what's going on around us and how can we have influence. It's certainly a dynamic environment. It's changing in ways none of us could have really anticipated, and yet with all that change, I think there's also opportunity to weigh in, share perspectives, and so for me it's how do we stay vigilant, and how do we do our best to have influence to help move the healthcare agenda forward on behalf of our patients and our communities.
Yeah.
And that's what we need to be about.
So Leanne, are we moving too rapidly in healthcare and creating burnout because we're moving so fast, or are we not moving quickly enough? I mean, the answer is both in some ways, but at CHPW, as CEO, do you feel the pressure from moving too quickly, more acutely, or the pressure from moving too slowly, more acutely?
Well, if you ask me, I don't think we're moving fast enough. If you ask people in terms of their everyday work, maybe we are moving too fast in terms of what we're asking from our limited resources to accomplish in a very short period of time. But I think that, there's a lot of challenges out there. That's always been the nature of healthcare, and the healthcare environment is to seek to overcome some very difficult external challenges. We have probably more today from the political perspective than we've had in a long time, but at the same time, the motivation to work harder, to be more creative, to be smarter in how we use our resources has never been greater. So from that perspective, there's more challenges. People across all of the functions are a bit burned out by that, but we're also motivated and inspired by the need and the ability to make a difference.
Yeah. Why don't you put your experience, Leanne, in Washington State in context? You've been here a little over a year, leading not just one of the 5 MCOs, but a unique model of managed care organizations, community-based or community clinic-based. How do you view Washington State compared to Massachusetts or other states where you've had experience? How do you put this model in context of the rest of the country?
Well, one of the reasons I wanted to come to this state and take this particular role was the amount of creative, innovative spirit and collaboration that is happening in the state of Washington. I was here a year ago to this very conference, and I was really excited by the conversation, which was very reminiscent of the conversation that I was having in Massachusetts with similar colleagues and stakeholders across the healthcare industry. There was a sense of we have to do this together. We're not going to be able to be successful if we stay in our silos. This is about how do we work together and expanding what it means to provide good healthcare. It really does involve the social determinants. It involves the broader communities, and I was very appreciative of the work that the state was already embarking on with the accountable communities of health care, and that I think gives us an opportunity that other states don't have. Massachusetts is also in that forefront, and Massachusetts was ahead of the game by having a very low uninsured rate. I think that's a prerequisite for any type of change in the right direction, is you have to have access for really as much of the population as possible in terms of coverage. One of the areas that has been of concern in this state is the access on the provider side. We've heard a lot about that today, particularly around mental health, particularly the limits on resources that we're seeing on the behavioral health side. That's a particular concern in this state that I think is really a pressing matter.
Yeah, the mental health piece is one we have not yet figured out, really. Gary, let me ask you the same question. I learned last evening that you have just finished being chairman of the Institute for Healthcare Improvement, Don Berwick's organization. You're still on the board there. What have you learned through that process in particular about where Washington State and the progress we're trying to make here, where does Washington State fit in compared to other states in the country?
I actually believe that Washington State stands in very good standing when you look at state by state on a national level. I think some of it, it's obviously multifactorial as to why that is the case. And we have data, of course, that shows that perhaps we're not as good as we would like to be or need to be in terms of health status. But in terms of commitment, engagement, I think we are thought of very highly. At IHI, you mentioned in particular the 100,000 Lives campaign. Many of you will remember from over a decade ago, Washington was one of only 2 states in the United States where every single hospital in the state signed on to be working on one of the clearly preventable causes of inpatient harm and safety. I think that began to improve our image. I think the Washington Health Alliance has been an important factor in, as a state of reform, but bringing together multiple sectors, creating more transparency. So I don't think we lead in everything. I mean, if you're from Massachusetts, I'm sure you think you're leading in everything. And I know Governor Kitzhaber's here, and Oregon has been a benchmark for many of us over many years. But I think we have a lot to be proud of in Washington State, and I think it's a great foundation for what we need to do going forward.
Let me ask you just this sort of follow-up question, Gary. What do you think you are most proud of at VM? VM's done a lot of stuff in terms of efficiency and waste reduction, very high quality scores, remaining independent in a very competitive market. It's one thing to be independent if you have a monopoly position. It's another thing to be independent in a very competitive market. What are you most proud of at VM?
Well, I think you just stated it. But, you know, obviously I'm biased. I'm a lifer. I've been at Virginia Mason for over 39 years.
Since you were 2.
Huh?
Since you were 2.
Since I was 2.
Yeah.
Passionate about our organization. And I think what I'm most proud of is the effort, as challenging as it is, to be true to who we are, the foundation of our organization, people coming together as teams on behalf of patients. You know, that was 1920 when we were one of those small group of clinics formed in the Mayo Clinic model, and then working hard to make that even better and staying true to that in this time, whether it's the marker's independence. I'm not sure exactly what that means, but we've said that we don't believe we have to be massive in order to survive and thrive. Mm-hmm. And in fact, we think that many things we have been doing might have been much more difficult if we had become part of a giant consolidated mega system. I think I'm proud of continuing to put the patient first and having a core business strategy around quality. I actually think that it is an important strategy in this market. We're not the only ones. We don't have a corner on that. I think there's so much great healthcare in the state and in this, in the region that I'm just proud that we're able to keep that going, and feels like every day we're getting better at it.
Yeah. Sally, you know, one of the things, we don't trumpet this, but this actually is part of what underpins our approach, is that we want to give people an opportunity to sort of express their best thought leadership and their best stories that maybe sometimes don't get told by other outlets. That question, I think, is indicative of that. I want to ask you the same one. Even though you're relatively new at the Nurses Association, what do you think nurses in Washington State should be proud of relative to perhaps other states where we're really making progress, or we're really doing interesting things at the provider, but specifically nursing level? How would you answer that question?
Well, I think we have several things we can be proud of. One would be our full scope of practice for nurse practitioners in this state. We were one of the first states to allow that full scope of practice. And I know others are hearing and still fussing with turf wars. And we passed that a long time ago. And I think that's fabulous and something that we can be standing in pride of moving forward. We also have a lot of other innovative approaches to care delivery that I think are in different communities. And I'm just going to pick on the Kent Fire District as one of those examples where paramedics are partnering with RNs to make visits to patients and avoid hospital admissions or readmissions. I think, working outside of the box, outside of the normal acute care mentality, we've done that, and we're doing that very well. We have lots of other opportunities. Yeah. Certainly, when you look at public health support, continuing to advance the work related to the CHIP program, making sure that stays in place, looking at how we can partner with schools in terms of making sure we have other practice sites that are incorporated into the education arena, looking at ambulatory care, for example, other communities where we can provide some support in a different way. But I think Washington's always been very innovative and not afraid of change, and not afraid to experiment and see what we can do to come up with different care models.
Yeah. In our afternoon keynote session in January of 2011, we had one of your colleagues on that panel, your predecessor on that panel, and I asked a question about, what was sort of one of the cultural pressing needs, and she said that we're trying to get nurses at the table. We're still trying to get them in the care coordination conversation and elevated beyond sort of a minority partner in the conversation of care. Now that we're in 2018, Do you feel like on the part of the nurses in Washington State that has been overcome? That nurses are really well accepted as part of this care team and as a leader in the care team in some cases? Or are nurses still trying to get at the table?
I think we're better than we used to be, but I think there's still some other opportunities. And certainly as life evolves and people do retire and we end up with turnover, those nurses at the table change over or could change over, depending upon that career trajectory, if you will, for those that are already at the table. But there's still a lot of focused work around trying to get nurses involved on different boards, trying to make sure that they are actively engaged in that work, not just limiting it, again, to hospital boards necessarily, but looking at other community health, school boards, et cetera, to stay engaged in those conversations. So I think we still have work to do. It's not perfect, but I do think it is better.
Yeah. Leanne, since it's just you and me here, I'm wondering if you'll tell me what you really think. The Healthcare Authority, as you know, is getting a new administrator. There has been some turnover there, also in the policy shop. There's changes in the governor's office. Do you feel any apprehension about the political leadership driving Healthier Washington, the integration of behavioral and physical health, this road that we are now well down, but which still requires political leadership? Is that in some threat or under some maybe constraints because of the turnover at the top? Or do you think that we're so far down that road we're safe on that score?
Well,
it's just you and me.
No, to be honest, I'm really looking forward to the new leadership, and I know that the current leadership is very committed to all the principles that are in the waiver and all of the actions that have already been taken. So I think we're well down the road, and I think that it's still, though, a lot of work to do.
Yeah.
And so we really do need strong leadership at the centralized level. And it's been an interesting journey because it's about ensuring that the communities are sufficiently engaged, represented, and fully in control of the areas that are very much specific to communities. We want that level of engagement and control. At the same time, we're trying to implement so much change, and there needs to be a certain level of consistency in terms of some of the key principles under the waiver. So how do we have that balance in terms of regional differentiation, which is really important, and community differentiation, and sufficient commonality in the principles that we can measure success, that we know that we're working for common purpose and that we're using our resources well. And I think that's the challenge for the central leadership of the state. And I'm very excited about the new head that's for the HCA. She's got an incredible experience in Colorado that I think will really serve us well in the state. So I'm looking forward to working with her.
Would you think, MCOs have to work across all of these regions, 9 regions. I'm wondering if you think that in exchange for the fact that we want to empower community voices, and that will lead to a diversity of programs and focuses, and we have to have some kind of central commonality, as you put it, that to be able to do both of those things, maybe we should at the same time narrow the full scope, not necessarily telling all regions that they have to do the same as other regions, but that maybe regions should do fewer things in order to be more successful at those things. Or do you think that the real magic of this is that we are going to let 1,000 poppies bloom, and not all of them will be successful, but some of them will be?
Well, I think we should have some agreement on priorities, and there is at this point across the state. There are a limited number of choices to really be focusing on. For example, the opioid epidemic, the integration of behavioral health and physical health. So there is that focus, and we do need that. At the same time, how we get there, there's room for a lot of variation, and we do have to recognize the differences that are specific to each community. So it is about balance, but we still need strong leadership at the state level.
Yeah. I think these are terribly difficult questions I just asked you. Thanks for taking them. Gary, let me ask you maybe a different question. It's sort of the same. It's just put differently, maybe more generally, but what are the things that kind of keep you up at night? What are the things that give you greatest concern about the future, about leading your organization and making sure that it's sustainable, for another 100 years?
Well, that's an interesting question, and we can take that in a lot of different directions. I actually sleep quite well, but I think that's independent of the magnitude of the challenges and the changes that we face. I think leading an organization is a responsibility that I think none of us who are in leadership can take lightly. I think at times like this, this is a time where we need to be more present than we've ever been. So one of the things I think a lot about is, again, in that internal sphere of how do I ensure as a leader that our teams are feeling engaged, empowered to do their best work, that we're working to create an environment that is conducive to that hopefully helps reduce burnout and the things of that sort. So the health of the workforce, I think, is a major issue for us. And as leaders, I think we need to be more present. We need to be honest. We need to be truth tellers. We need to provide perspective and connect dots, and we need to communicate. And it used to be you'd say communicate, and that meant we send a memo, and everybody would read it, or we convene a meeting, and everybody would show up because that was how people like to participate in organizational life and get information. Today, there are so many different ways that people prefer to get information, and it's quite diverse, that I think it's impossible to over-communicate as leaders. So I think a lot about that. And then obviously what's going on around us. I worry about the pace of the transition from fee-for-service or pay-for-volume to pay-for-value. Some have said that it's slowed dramatically. I don't think we as a society can afford that, and we need to continue to move and accelerate this work. And I could go on and on about that, but yeah. I think that sometimes we're our own worst enemies in that regard as well.
Yeah. Sally, how about you? What are the things that should be keeping legislators or the governor or state agency staff up at night, metaphorically? From where you sit in the healthcare system, what should they be thinking about that they may or may not be?
I think it's a lot of the same things that Gary just said in terms of making sure people have the information that they need in order to make the decisions that they're going to need to make, and making sure the communication is happening at all different levels, different methodologies, et cetera, so that people are getting the information and not having to fill in the gap. Because if there's a void in that communication, people are going to make it up. Yeah. And they will fill that gap on their own. So if there's a way to avoid that, I think that's extremely important. And I think, a lot of it does go back to managing that workforce and making sure that they are able to do the work that they need to do and have, again, the information that they need in order to carry out that work and meet those demands. So I don't think you can over-communicate. I absolutely agree. I think the other piece that sort of is touched on, but I just would want to emphasize, is just maintaining those relationships and trying to stay true to each other. This is a big room of a lot of people, and we're very smart, intelligent people, and it is kind of that time to just continue to lock arms and help strategize how we are going to move into the future in a different world. Yeah. So I think that's another big piece, is the relationship component.
Leanne, let me ask sort of a implementation question within this, sort of building on that. I like the metaphor of boiling the ocean, and that we should not boil the ocean or attempt to. What do you think people should be focusing on, either operationally or culturally or otherwise, to sort of move us forward collectively as a community, either as organizational leaders or in terms of reaching out to other across silos? Where should people be focusing their immediate energies?
Well, I think if we start with the premise that it's all about the patient, we can't go wrong.
Yeah.
And if we think about the broader principles of how would we want to receive care as a patient, it's kind of a guiding principle for me in terms of how we focus our own priorities. So our organization is really focused on ensuring that we really provide integrated whole person care. And what does that mean? You know, which we want to put as much teeth behind that as possible and provide as much support behind that as possible. And that requires partnering, by definition, with multiple sectors, multiple providers within the community. Now, the heart of our organization is community health centers. Community health centers have been providing whole person integrated care from time immemorial. We've been around for 25 years. That's the nature of who we are. But it's now about expanding that, finding ways to partner, you know, across schools and criminal justice systems and certainly hospitals and other systems that have not previously been as involved in the broader aspects of an individual's care. Of course, that means we have to align our incentives. So all these things are connected. When you say, what do we focus on? If we start with the patient, if we start on the whole person integrated care model, everything else kind of follows. What supports do you need for that? What are the preconditions for that? What are the most important external factors that we all have to agree on are necessary in order to provide that? That's the way we look at it.
I'm sure you've experienced this during your tenure at CHPW. I would just say, I believe that, like I said about Virginia Mason, I think that there's a sort of latent pride in Community Health Plan of Washington among people who have watched it come out of nothing, essentially, as a plan on the plan side 25 years ago. So I just think, you know, the people that value the independence of the payers and providers in Washington State, generally speaking, I think appreciate CHPW's role. I think they appreciate Virginia Mason's role. I think, you know, there are other organizations as well. And I think there's this, like I say, this latent pride. So Gary, do you think that what are your thoughts on this sort of, if part of this latent pride comes from the fact that you are born here and independent, what does independence continue to look like moving forward for plans and providers in an age where we are seeing massive consolidation in other parts of the country, and now we're seeing vertical consolidation? The CVS Aetna deal, for instance, is a big deal, and I'm told that Amazon, you know, this is just totally rumor, and we haven't put it online, but that they are not just looking to get in pharmacy, but that they're looking to get into insurance and maybe will purchase an insurer. Where does an independent fit in on all that?
Well, it's an interesting question, and I don't presume to, you know, have a crystal ball or know the answers. I think increasingly it will be clear that creating value is the imperative in healthcare. And up to this point in time, the data is suggesting it's not the case that consolidation is the pathway to creating value. In fact, there's been numerous studies that have shown that the number one result of massive consolidation is sustaining high prices. And I think we have to, you know, that's not universally the case. That's not every consolidated system. And at Virginia Mason, independence for us means growth. It means increasing strategic partnerships. It means finding the right organizations that become part of our organization, such as Virginia Mason Memorial in Yakima, or Edmonds Family Medicine, which will be joining us in February. So, you know, organizations that share our worldview and we're aligned. So I don't really know what independence is going to look like down the road, but I think it must be about creating value, or we will cease to have a future.
Yeah.
And I think, you know, I made the comment a couple minutes ago that sometimes we're our own worst enemies. And some of you have heard me say this, but I think many of us are impatient and want to see movement. And I hear many of my colleagues as CEOs and physicians and others say, woe is us. You know, we've got one foot on the dock and one foot in the boat. Or we've got one foot in the canoe of pay for volume and another foot in the canoe of pay for value. And frankly, I think that's a morally bankrupt argument. That's basically saying that until you pay us differently, we're going to keep ordering unnecessary tests and doing unnecessary things. And I think that's the antithesis of professionalism. So when I talk about creating value, I think it's coming face to face with the waste that's embedded in our system. Every study says it's a third to half of what we spend our over $3 trillion on. And part of that, you know, there's fraud and abuse, and there's the waste of professional liability and all that stuff. But part of that is on us as delivery system, as providers, and embedding appropriateness in our notion of quality is, I think, critically important going forward. So regardless of what independence looks like, for me and I believe for us at Virginia Mason, and for many of us in this room, I believe that the path forward is to focus on creating value and to be transparent and willing to look at our own selves as to what it is we can do to help be part of the solution.
I'm going to tell you, we video record this, and we'll send this out. If we weren't recording it, I probably would have stood up there and given you a round of applause. This idea that the moral bankruptcy of woe is me, I think is fabulous. Thank you for saying that, because
and I'm not naive. I mean, I get the deal. I mean, it's hard in this mixed environment. We got to have systems that support this, but you know, what are we really saying when we say that?
Yeah.
And I think that's what we need to be willing to shine a bright light on.
So Sally, you know, blank slate to follow up on that. I mean, part of what Gary's saying, if I might put words or paraphrase, is that providers sometimes, you know, don't get on board. They complain too much. I think many of us have heard the complaints, but yet we have significant provider burnout. How would you respond to that argument on behalf of providers?
Respond to, I'm sorry.
This notion that we hear from many providers, and they say that, woe is me,
Right.
you're asking me to do too much. What I want to do is take care of the patient in front of me. I don't want to become a data entry clerk and work in my EMR and fill out all this paperwork and all of that stuff. And those are all totally valid points. And that does lead to provider burnout. Yet, nevertheless,
It's life.
right?
I mean, part of it really is the environment that we live in. You know, it is fast-paced, there's a lot of change. And, you know, again, I think it's making sure people have the information and the tools they need in order to do the work that they need to do. And that burnout can often comes from feeling like they don't have the resources that they need or the time it takes in order to do the work that's being asked of them. You know, we still have a lot of work to do around how do we make things more efficient? How do we make it more effective? I think involving those that are providing that direct care in those discussions and decisions is vital because they know what's broken.
Yeah.
They know what is getting in the way of their ability to do that work. And I think we are all in leadership roles where we need to listen to that and use that information to effect additional change. You know, it's tapping into those minds and seeing what they come up with. You know, we have some very inefficient, still to this day, you know, rules in place that get in the way of being able to deliver the right care the right way at the right time with the right people, all those things. And I think we have to listen and see what we can do. And I think engaging those individuals will get them back on board and make them feel like they are a part of the solution. They're not just, you know, left to whine.
Let me ask, sort of following up on a different point that Gary made regarding independence versus consolidation. From the view of nurses, do you see any benefit, any liability, any change or impact or implication from some of the provider consolidation that's taken place in Washington State?
Well, I think it's probably mixed. You know, some works very well. Some there's still some things that can be perceived as barriers. Creating additional layers that you have to go through for approval processes and that kind of thing can slow you down or bog you down. So I think, it's probably mixed. Sometimes it's working very well and there's some benefits to be gained, and then sometimes you hear that it's a problem. It's creating an additional barrier or layer that makes things less efficient.
Yeah. Leanne, we're getting close to the end. I thought I would ask each of you this question to conclude, and I'll let you kick it off. What counsel or advice or guidance would you give this audience of 600 some odd folks, recognizing that this is the room? If 80% of the people in this room agree on something, magic will happen, right? Mountains will move in healthcare in Washington State. What advice or counsel would you give to this crowd about the future of their organizations, about their advocacy and policy, and how to lead moving forward?
Well, the good news is I think we're on the right track. I think if we stay the course in terms of the direction that the state is moving in, we'll see very positive change. We will see improved costs. We will see improved quality. And the direction, I think we generally agree on that in this room. I haven't heard a lot of controversy over what we have to do together to be successful. We have to make sure that Washington, D.C. doesn't throw a hand grenade into the work that we're doing here. But I think we're all moving in the right direction today, and we just have to continue to work together.
Yeah, good. Thank you for your leadership at CHPW.
Well, you're welcome.
Sally, let me ask you, guidance or counsel to this audience?
Well, I kind of have two mottos. One is assume good intent. I think people trying to navigate this system, even though it's as complex as it is, are really trying to do the right thing. Mm-hmm. And granted, it might not be perfect. It still has to be tweaked here and there, but assume good intent. And the other one is to proceed until apprehended. And just keep moving.
I love that. Proceed until apprehended. I love it. Thank you for your leadership, Sally. I appreciate it. Gary, you want to give us the last word, guidance or counsel to this room of folks?
Don't slow down. I think, we've been on a trajectory, particularly here in Washington State over the last decade, that is something we can and should be proud of. Whether it's the 100,000 Lives campaign, as I mentioned, or the BRE collaborative that has raised standards in the bar for what should be expected from all of us to deliver on behalf of our patients, to the healthcare authority and many things that are happening in both the public and private sector. I think we need to accelerate this work. Some have suggested that maybe we just take a deep breath because the signals coming out of Washington are retro in some respects. And Back to the Future, it's so reminiscent to those of us who've been around a while to what happened in the early 90s, where we had the Clinton health plan here in Washington State. We were organizing around new systems of care, and then the legislature changed and we went back to the old economy like in a matter of minutes. And so I think we can't afford that today. I think the impact we have on our society is in the healthcare sector, both in terms of the cost of care, and almost 20% of GDP, but also on the toll ineffective, unavailable, unaffordable, limited access healthcare has on individuals and their families. And so cancer doesn't take a deep breath, or diabetes, or behavioral health issues. And so I think we got to accelerate this work, and we got to find new and even better ways of working together. So I would say thank you for bringing, the stakeholders from so many sectors into this one room today, and the work you're doing, and the work that all of our colleagues and everybody's doing out there. We've got a lot of unfinished business.
Let's give them a round of applause.